One of the most common questions that I get asked about being a doctor by people thinking about applying to medical school and from members of the public is, what exactly do you mean when you say you're on call? To be honest, this mostly happens when my friends on a kind of given night of the week ask me to come and do something, and I look at my rota and say, actually I can't, I'm on call that night or I'm on call that weekend. So what does that actually mean? Welcome back to the channel. My name is Ollie. I'm a junior doctor living in England and working in the NHS. This is part of my AskADoctor series where I take one question that's been sent in, explore it in a bit more depth and try and clear things up. But to try and jump into actually answering the question, being on call can potentially mean a few different things depending on your perspective. And mostly it's going to depend on your grade, that is how senior a doctor you are or how far through your training you are towards becoming a consultant. So for me as a very junior doctor, for example, I'm what's called a foundation year 2 or a second year postgraduate doctor. It means that I am available when someone calls me. Essentially, I am on call. For example, if I'm working at the hospital after 5 p.m. on a given weekday or at the weekend, very little medical treatment is going on during these hours. Routine elective activity is stopped, so there is much less routine, typical work for a doctor to do. However, some jobs will still need doing, those that are more urgent and need doing when someone comes in, or if someone becomes sick and then needs urgent review by a doctor. So basically, out of hours, beyond the routine working hours, the department doesn't need a full cohort of doctors because there's much less clinical activity going on, but you still need enough doctors present to provide that basal level of service and to ensure that patients can be seen if a doctor is required. You are on call because you will come if someone calls you. And at the very junior end of the training scale, where I am right now, being on call requires you to be on site, what we call a resident on call, in the hospital during the hours that you are on call. Now, thinking about the other end of this spectrum, as a doctor becomes more and more senior, they will typically become more specialist and capable of doing advanced specialist procedures that only they and a small number of other people can do, and become capable of managing more complex and more unwell patients. And given that, as I've said before, patients can become very unwell at unpredictable times at any time of day or night, or potentially need these specialist procedures doing, especially if they're life-saving, at any time of day or night, there will usually be a senior registrar and then a consultant, the most senior grades of doctor, on call for any given department most of, if not all, the time. For example, one of the most urgent and important interventions that is carried out within the NHS on a daily basis up and down the country is what we call primary PCI, percutaneous coronary intervention. Most of you will have heard of this before, whether you know it by its medical name or not. When someone has a heart attack and a clot blocks off one of the coronary arteries which supplies blood and oxygen to the heart muscle, a cardiologist can insert a wire into someone's artery and remove or dissolve that clot, oftentimes placing a stent to maintain its patency. There are very narrow time frames in which this has to happen to get the best outcome for these patients, and because people can have heart attacks at any time of day or night, this means that you need doctors who are capable of doing this procedure on call and therefore available at any time of day or night, 365 days a year. And not just the doctor who does the procedure, but the rest of the cath lab team in order to actually do the procedure. And exactly the same principle applies for doctors in many specialties, where if a situation is too dangerous or too complicated or too pressured for the doctors who are on site to contend with, and you need a really experienced and knowledgeable doctor basically to come in and sort it out, then there will usually be an off-site or non-resident on-call consultant who, if things get really bad, you can call in and they will come and give their knowledge and professional expertise. A doctor or a surgeon may actually also be on call for more than one specialty, not just their own, what we often call parent specialty. For example, in my first ever job as a doctor, when I was working with the HPB and transplant surgery team, so that's transplant and patients who have problems with their liver, pancreas and gallbladder, I would also cover on call the vascular and colorectal surgery teams. This is really common for doctors at many stages of their training, and it's this, often combined with our long working hours, that means that junior doctors build lots of experience in lots of specialties really quite quickly. And to finish up, just bringing things back to perhaps those of you that are thinking about applying for medicine, or those of you in medical school or even early careers and are thinking about a specialty that you might want to pursue when you're a more senior doctor, the amount of on-calls that you will have to do is often something that should feed into a specialty decision. As a general rule, more acute specialties with more emergencies tend to have more frequent and more busy on-calls than those that have fewer emergencies or less acute specialties. And fundamentally, this means that a doctor training in cardiology, in neurosurgery, in anaesthetics, in obstetrics and gynecology will probably have to deal with more on-calls than someone training in rheumatology, urology, psychiatry or dermatology. And this general rule will continue to apply not just during training, but when you're a consultant as well. So as part of the long-term planning for what your career might look like, be sure to have a read into how much on-call your specialty of interest might do, and whether you think that might be suitable for you long-term. Thanks very much for watching, guys. Please be sure to hit that like button for me, leave a comment, subscribe, and go and check out my website, ollieburton.com, for more videos and articles just like this one. If you've got a question to submit to this series, either from a medical or a non-medical perspective, please let me know and I'll address it as soon as I can. Thank you very much. Bye-bye for now.